A very good evening, all. I'm Aditi Lamba, coming to you from a remote location in New York City. Welcome to Vision of Asia South Asian News segment. This is our ongoing report on the coronavirus pandemic. Current numbers of global cases have topped 3.2 million and more than 230,000 deaths across the world. In the United States, we have over a million cases and more than 61,000 deaths. This surely is a tough time for us as the nation grapples with COVID. As we speak, more than 24 US states are moving ahead with their plans to relax restrictions on business and social life, hoping to reverse the economic fallout and millions of unemployment claims. The White House guidelines for social distancing expires today, while Dr. Anthony Fauci, leading infectious disease official, warned states against moving too fast, addressing the seriousness of COVID-19 spread. Here in New York City, state and local governments continue to promote the message of stay at home, stop the spread, and save lives. Reach us. If you are located in a state which is reopening, we would like to hear your experience. Also today, a very sad day that shocked the Indian movie industry. Veteran actor Rishi Kapoor has passed away at the age of 67 after a long battle with cancer. Bollywood is truly mourning, and we have tonight comments coming in on Rishi Kapoor from actress Prachee Paandya, along with more updates on COVID-19. Let's take a look at the headlines now. Exclusive: actress Prachee Paandya remembers legendary actor Rishi Kapoor. Dr. Jewish Qatari on coronavirus developments, testing, and frontline experience, New York City. Preeti Gandhi on empowering women during COVID-19 nutrition and fitness, Pennsylvania. Time for a short break on Vision of Asia. Voice of the Community will be back shortly. Welcome back. I'm Aditi Lama, and this is Vision of Asia special report on coronavirus impact, measures, and updates. Today, legendary Indian actor Rishi Kapoor passed away at the age of 67 in India after a brave battle with leukemia. The veteran actor has been remembered by millions of fans globally and has surely left a huge void in Indian cinema, leaving a legacy of decades of movies. Following Rishi Kapoor's death, Indian politicians, leaders, and the entire Indian film industry are paying their tribute to the renowned actor. Earlier today, we spoke with Indian film and television actress Prachee Paandya, who remembered some great moments and her learning experience with Rishi Kapoor on the sets of multiple movies. Prachee Paandya also shared that she considers herself very fortunate to have worked with Rishi Kapoor and shared on-screen space, and she was very grateful to have known him.
Everything just looked and seemed so easy with him around. In spite of the fact that he is coming with such major volume of work and
Right.
his range of career that he's had, and I was always overwhelmed just sitting beside him, and I used to always tell him that, and he used to laugh because I used to tell him, I said, I still can't believe I've grown up watching Chandni, I don't know how many times.
Yes.
I said, and here I am sitting next to you, and you know, in spite of the fact that Mulk was like my third time experience with him in terms of working with him, and it every time just felt like
Yes.
there's going to be something new, there's going to be a new input, and there's going to be a new kissa that he's going to sunao me. He used to always tell me about those days of his old days where there weren't these kind of facilities that we actors have today, right? From vanity vans to
Correct.
AC studios to
Resources.
everything that just helps you as an actor to kind of look good or feel good.
Yeah.
This wasn't the case back then. And he used to always say कि हर चीज में अगर मेहनत करो तो you always get that payback. Um, and yeah, I still remember during shooting of Mulk, we did a very, very important and difficult scene. And in fact, it was my close up, and he wasn't even in the frame, kind of partly in the frame, but with his back. And he need not have, um, kind of, the actor has to give the cues to the other, the co actor,
Yes.
and not necessarily that you actually give it in an involved way. Ideally you should, but for me, I never expected, because a, it was very, very hot, b, we were having a rough day, and he still made it a point to give me those little inputs which would better my performance, and said कि अगर तुम थोड़ा सा इस तरह करोगी तो ये better होगा, it'll be better for you.
Yeah.
And I was so taken aback because, for an actor of his status, his caliber, a legend that he was,
Right.
it was so overwhelming for me to even digest the fact that there's an input coming in from him,
Yeah.
and he's worried about the co-actors' performance equally as well as his own, which was so gratifying to know that, otherwise when you reach that stage in your career where you've done it all and you don't really bother, you're not like, कि it's मेरा shot नहीं है तो मैं, it's never like that. It never made me feel like I was just another an actor who's probably still trying to do so much more in life. So never made me feel, you know, that I was in fairly new compared to him,
Sure.
compared to the kind of work that he's done or the seniority that he had. So I think it was, there's so many things. I mean, as much as he was so workaholic,
Yes.
he was equally, equally fun loving. I mean, he loved food. He
Yes.
loved,
Definitely.
yeah. I mean, he would just crack up into a joke any time of the day, and when he was working, he was working. When he wasn't, he would be completely just kind of doing his own bit and interacting with all of us, making everybody else comfortable around him, asking whether we needed anything to
Wow.
eat or drink, or anything that came for him.
Mm.
Like his staff would bring it for him, and the first thing he would do is offer it to all of us, the co-actors, which was, little things you don't expect, because you look up to a star. And yeah, I mean, it's still very, very difficult to digest the fact that we are not going to see him again, or I'm never going to even get a chance to work with him again because he's just no more. And with this state of lockdown in the country,
Yes.
where as it is everybody is on a low, and this just kind of gives you all the more of a sinking feeling, which isn't very good. So yeah.
Prachee, he was only 67 and fought with cancer so bravely. He was actually in New York. We had the opportunity to see him last year around Independence Day time. And, he still was speaking so strongly about the world of acting, cinema, supporting the industry people that were here in the US. What do you think, is his mark that's left on the industry today? And what do you think he means for actors such as yourself?
I think it's just a void. I mean, but I feel the film industry has lost almost like the head of the family. It feels like that, uh, because he's just, like I said, he's coming with a legacy. I mean, he was, almost, like I said, the head of the family of the industry. Where you felt like, um, his aura, his personality, his talent, his is just unmatched.
Yes.
One of the finest actors actually that we've ever had. So it's a little tough. I think everybody's in a state of shock. Everything that I read on the social media, and whoever's, all my co-actors that I, my multi actors that I've been talking to all day, and it's it's a little difficult, just too difficult to kind of sink in.
We have now another segment of our interview with Dr. Janish Qatari, who joined us from New York City. More than half of the United States will be partially reopened by the end of this week, while hotspots remain in lockdown, such as here in New York City. While that is happening, infectious disease official Dr. Anthony Fauci said that he expects FDA to issue an emergency use authorization for a possible COVID-19 treatment. Dr. Qatari provided us details on reopening along with his take on developments in treatments, drugs, and trials for the coronavirus. Also addressing the collaboration as well as camaraderie of the medical community, Dr. Kothari showcased his gratitude for healthcare workers that are on the front line. Here is the story. What is the condition right now, and what is happening in critical care in terms of taking care of patients and also taking care of COVID patients?
I've spoken with other physicians across the country and frontline workers at different institutions, and some of them have been using their N95 mask for upwards of 3 weeks. And there are nurses that have walked into the hospital, they get one gown and they get to use that for their 12-hour shift. and so there's certain other people that are dealing with that. So I could think that's really much just institutional based. And it's also really nice to see that there are third-party vendors that have just actually donated a significant amount of stuff.
Right.
At least from my perspective, we had thousands and thousands of masks donated to the point where we've actually told them, just, okay, we have too much, just give it to other people across the country, because we don't even have space to keep all that stuff now. So we're actually very fortunate and blessed, I would say.
You know,
And
and also, just you're talking about donations, there is this huge a movement for helping doctors, and feeding doctors of America, where many organizations are donating food. I know your hospital and you personally have experienced that too. I would love for you to highlight that as well.
This is something that came out of nowhere. Nobody was anticipating this. And amid all of this, we've all been truly humbled by the generosity from many vendors across the nation, particularly in New York City. So many of the local restaurants and within Brooklyn, where I live and where my hospital is located, they've donated food to us on a daily basis. For about the last 6 to 7 weeks, almost every meal has been provided: breakfast, lunch, dinner, sometimes snacks in between. And coffees and like chips or whatever, protein bars, like fruits and vegetables. People just been donating so much,
How
And
is the medical community holding itself according to you? And, what keeps you grounded these days, if I was to ask you?
So the people that are in training right now, they're in different departments, right? Like I'm in internal medicine, so I deal with this kind of stuff all the time, just not the severity, but I deal with these types of diseases. But things like surgeons, they're not getting to go into the OR as often as possible to do routine and elective procedures. People that are gastroenterologists, they do colonoscopies and endoscopies and stuff just for screening measures. They're not getting to do that. So they've sort of been pulled into doing what I do on a daily basis. So I know from a training perspective, training, at least in these certain fields, are anywhere from 3 to 5 years. So these people aren't getting their level of training that they would normally get. So I can imagine it's taking a certain toll on them in terms of their confidence. There's certain people that are on the ending, that they're at the end of their training. So they might have to like move on and then not have completed the last 6-7 months of honing in their skills and, kind of doing all that stuff. And that's definitely affecting them. So, and I can't imagine the kind of mental, toll it's taken on people as well. There's a recent report that just came out that 2 physicians actually committed suicide. One was an emergency room doctor, and one was, I forget what they were, but another physician. And the report didn't say why, but they thought it was related to the stress of work. So there's definitely a wide range of people and their responses to how they're handling this. For me personally, what keeps me grounded is that I work in an environment with people that I really enjoy being around. I have a supportive, strong network. Me and my sister actually work in the same hospital, so I see her all the time. I'm actually sitting in her office right now. I don't have my own office. But so it's really cool to I can't see my friends, I can't see my family, but I have my sister here with me. And we have a lot of camaraderie within the hospital amongst the staff, the nursing, nurses and my colleagues. So it feels really homey here. And so this is my family right now for this last few weeks.
It's time for another show break. Stay with us in Vision of Asia. Voice of the Community will be back shortly. Welcome back. This is Vision of Asia, Coronavirus Pandemic Special Report, and I am Aditi Lamba. Bringing a positive and empowering perspective through this pandemic, we have now an interesting segment featuring social media influencer, life coach Preeti Gandhi, who joined us recently for a virtual conversation from Pennsylvania. Preeti, who focuses on empowering women through fitness as well as healthy eating, provided some key tips as well as measures for all to stay fit and mentally well through these tough times. Highlighting elements on vegetarian, nutritious eating and consistent exercise, Preeti Gandhi also advised on building good habits during this pandemic as well as working on strengthening within ourselves and self-care. Here is Preeti Gandhi, who showcased also a quick, healthy, tasty recipe for all our viewers. This is in terms of importance of self-care and also taking care of our body at an older age, which is a very common thing that we see, among South Asian women, which is, lack of taking care of themselves, lack of diet, higher increase in other issues. Your personal take on South Asian women and the way they take care of themselves and the way they should take care of themselves.
Right. So what I have seen personally,
Yes.
my experience and, my friends, what I started seeing is women started to really you're raising kids. So your focus is 100% on the kids. I need to feed my kids well. I need to make sure my husband has a nice meal every day. But what about yourself? A lot of times we end up just dealing with leftovers or just eating anything. People are just saying, I'll just eat anything that's cooked for my family. We never really focus on what our body needs are. So that's a very common trend I see in women. They're not eating enough. And then how do they fill that void, right? You're still hungry. Right. Then they fill it with carbs. And then they fill it with things that aren't doing good for themselves. Alcohol, that's another big thing I'm seeing a lot in our South Asian community that, at night, everybody wants to just because you're quarantined doesn't mean you have to have alcohol every day.
Right.
Things like that. Emotions play a huge part on how you eat. I talk a lot about emotional eating because I used to be at the point where I used to binge eat at night when everybody was asleep. I'd go in the pantry and start picking on cookies or namkeen. And you don't realize all those little things add up, even though you ate well for the majority of the day. Yeah.
Yeah, definitely. So in terms of just talking a little bit more about eating habits and sort of bringing it together with the meal plan that you do, can you break down what a plate should look like? Or perhaps through your meal plans, if you could give us some basic tips on what, especially women, what they need to focus on. I know you do a vegetarian diet, so that's something that's also very popular amongst the community as well. If you could give us an insight into how we need to look at this portion control, I think it looks really interesting. So let's let
Absolutely. Sure. In fact, I drew it out on a plate, so I hope that's okay if I can share it with you. So this is what a plate would actually look like. You gotta look at your plate. Does your plate look like this? Is half of your plate have vegetables, 1/4 carbs, and then 1/4 protein? So now when you're talking about your carbs, yes, you can do your roti, you can do your rice. I'm never going to say no to things that are, soulfully satisfying to you. Yes, you can even do bread, but obviously I'm going to recommend avoid the whites, try and pick up the more grainier breads, or, you can do any type of, Indian grains that are out there, pulses, millets, whatever works for you, put it in the carbs. Proteins. A lot of people ask me, as a vegetarian, how do you get your protein in?
Right.
So guys, we are, our culture offers so many sources of protein, we don't even think about it. All our whole dals. Now, I'm not talking about the split dals or the ones without the skin, the whole dals. Those are the ones which are the most nutritious with protein. Most of them have 10 to 13 grams of protein in it. So try and focus on getting your whole moongs, your kala chana, your choli, your rajmas, even pinto beans, black beans, all of them are great sources of protein. Yogurt is a great source of protein. Paneer is, I counted 50-50 on my plan because I know in India they've enforced a lot, have paneer, it's high in protein, but it's also high in fat, guys. That's like a cheese. Paneer is a cheese. So I tell my ladies, you can have paneer once or twice, max in a week, but try and focus on getting more the other vegan-based proteins.
In terms of just keeping yourself on track, what are some of the tips that you can give us?
So first of all, you need someone to hold you accountable because you might have tried it alone. It gets tough. I can tell you, I've tried it so many times alone and it is tough. You cannot stay motivated for a long time just by yourself. So you have to find a community that can hold you accountable. It can be your best friend. It could be your husband even, or your roommate, whoever you're with. Just say, hey, how about we do this together? We're going to hold each other accountable. We're going to make sure that, hey, we've had our water or we've had our meals on time, or we've worked out together. You can subscribe to so many online workout programs. And the one I obviously recommend is our Beachbody workouts because those are the ones I've been doing for 4 years and they have all levels of workouts, whether you have zero equipment, beginner, to someone who's advanced and has equipment. There's a whole array of it. And honestly, what I do recommend is also tracking, maintaining a journal of what you're doing daily, what you're eating, how much. There are like apps to help you even track it. And that's exactly what I tell my clients is like, use the tracker app, start tracking everything. And visually, we are very visual. More than writing, we're visual. If we see, oh, I've done this, like you start checking mark those boxes, you're going to feel accomplished. That's
Hi there, this is Preeti Gandhi and I'm here to show you how to make Tandoori Keema. So this is literally a staple in my house. This is the first recipe I usually start all my clients with because it is a complete meal. Why? Because it's got your vegetables, it's got your vegan protein, it's got good wholesome carbs, which is quinoa, and also all these other vegetables and seasoning that is close to our palate. So we're going to start today first with sauteing our onions and ginger garlic. I put some ghee in a heated pan. So I'm taking about 2 tablespoons ghee. I'll use my masalas. So we put some hing in this and jeera. Once that sizzles for like a minute, I will add my ginger garlic paste and onion. Saute this for about 2 to 3 minutes so it's slightly brown. So now that the onions are cooked, I'm going to add the peas, carrots, and corn that I had defrosted. You can find this in the frozen section, very easy to find. Saute this for another 2-3 minutes. I will add a little bit of dhania jeera powder. So here we go, sprinkle a bit of that, a tiny bit, because most of the flavoring is going to come from the tandoori masala. And for color, I'm going to add a little bit of turmeric. And now, saute this till the veggies kind of cook halfway. I will add chopped tomatoes I have, the chickpeas, and some tandoori masala. Be generous with your tandoori masala. It's usually a little spicy, so that's why I didn't add any chili powder. If you like your food spicier, definitely go for it. I will add some freshly squeezed lemon and a pinch of salt. So I have my quinoa soaked. Soak it for like about 10-15 minutes before you cook it, so it sprouts a little. And now I will add my soaked quinoa here. Keema needs a little bit of water, extra water to cook well. I use a tri-colored one. You can pretty much use any quinoa in this recipe. And secret ingredient is kasturi methi, which I already pre-soaked. It gives it yummy flavor to this whole dish. And I'm just gonna mix it, cover it, and let it cook for like 10 to 15 minutes. Here you go. 10 minutes later, your tandoori quinoa is ready to go. You can sprinkle it with some fresh cilantro and enjoy it.
Now, a community shout out for nonprofit Sant Nirankari Mission USA New York chapter for their incredible donations of masks and gloves to community in need. They're also donating food for hardworking healthcare workers across the New York state. This coming Saturday, May 2nd, the Sant Nirankari Mission will hold another distribution of masks as well as gloves for community in need at its centers in Westbury, New York. Call 516-214-4357 for more information. And this is all for our show for the night. Remember to send us your suggestions and get your voices on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. Remember to also subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight. I am Aditi Lamba. This is Vision of Asia. Take care and be well and stay very safe.